Hello everyone, you're watching Physio Classroom channel, and in this video we are going to learn practically the kinesiotaping method for bicipital tendinitis or tenosynovitis. Now bicipital tendinitis is characterized by irritation and inflammation of the long head of the biceps tendon, either at the level of the bicipital groove or at the level of supraglenoid tubercle, subacromially at the level of its insertion. The irritation and inflammation of the biceps tendon causes shoulder joint dysfunction in the form of pain in the anterior region of shoulder and restriction in the range of motion. The kinesiotaping method that will be demonstrated in this video is going to help in reducing pain and inflammation and restoring pain-free range of motion in the shoulder joint, thereby improving the quality of life of such patient. So let's get started with the practical demonstration of the kinesiotaping technique for bicipital tendinitis. So the first tape that we are going to apply is going to be a Y strip, which I have measured and pre-cut here. This is going to be applied from the insertion to origin for the biceps muscle in order to relax it. So always remember, whenever we are treating a pathology which has tendinitis or muscle issue, first step is to relax those structures in order to give time to heal. So before we start with the taping, the part has to be prepared so that the overlying skin is stretched. For this, we are going to keep the elbow in extension position, shoulder in externally rotated, slightly abducted and extended position. So this is going to be the position of the shoulder joint and elbow joint before we start with the taping. So start by first preparing the anchor, tear off the paper backing. And now this is going to be applied over the radial tuberosity, that is the insertion of the biceps muscle with no tension. Rub the anchor so that the glue is activated. Now from here we are going to take the outer eye strip and we are going to remove it. And now with no tension we are going to follow the outer border of the biceps muscle up to the AC joint. And then with no tension we are going to apply the remaining strip. Similarly, the inner eye strip is going to be applied over the medial border of the biceps muscle, and this is going to end over the coracoid process. So we are going to just remove the paper backing, and then with no tension we are going to follow the medial border of the biceps muscle, and then we are going to angle it towards the coracoid process. And then we are going to rub the tape to ensure that it adheres well to the skin. Now next we are going to mark the area of pain. So let's say the patient is complaining of the most severe pain at this particular location. So it can be here also. So wherever is the site of pain, just mark it so that next we can apply the space correction taping to reduce pain and inflammation. So there are two options by which we can help in reducing the pain. One is we can use a 6-inch eye strip which can be applied first beneath the coracoid process, and then with 50 to 75% tension we can apply it over the area of pain, and then the remaining anchor is going to be applied behind the shoulder joint. The other option is to use a Y strip, apply the base again beneath the coracoid process, and the two tails are going to be applied in such a manner so that they surround the area of pain with deep pressure. So let's just use this method for now. So for this we are going to first again create the anchor by tearing off the paper backing, and then with no tension we are going to apply it just below the coracoid process. Rub the anchor to activate the glue, and now remove the paper backing of both the tails of the Y strip, and now just keep hold of the end part of the Y tails, and now apply about 50% stretch, and then with deep pressure follow the area of pain. So this is the first strip and this is the second strip. The remaining part of the strip is going to be applied with no tension. So for this we are going to ask the patient to flex the shoulder and slightly horizontally adduct it, and then with the remaining part is going to be applied with no tension. Relax. So this is one of the simple way in which we can kinesiotap the bicipital tendonitis condition. See you all in our next video. Till then, keep learning,
Keep sharing
and stay connected.